Bottom line for the vitamin D story is vitamin D deficiency is a disease of neglect. There's a mountain of evidence now linking vitamin D deficiency to chronic illnesses. So there is no downside, in my opinion, to improving your vitamin D status and getting some sensible sun exposure. And I don't think we need to be a genius to know this, that we need sensible sun and vitamin D supplement recommendations. It's not a hypothesis.
Sunlight. We all feel better when we're exposed to it, but do we know the reasons why? Hi, this is Dr. Mercola helping you take control of your health, and today I am joined by Dr. Michael Holick, an expert in vitamin D, and he will help us understand those reasons. But before we go into the lecture, Dr. Holick, that you're going to share with us in a PowerPoint presentation, I'm wondering if you could, because there's many people who amazingly don't know of you yet, so if you could expand on your background and your history. I mean, you've got so many credentials and appointments. It's really amazing. So if you could provide that information for us, it would be greatly appreciated.
Sure. And so I happened to be in the right place at the right time. I knew I wanted to be a physician and a scientist, and I went off to the University of Wisconsin and worked with Hector DeLuca on vitamin D. At the time, vitamin D was thought to be, a hormone or a vitamin found in cod liver oil, prevents rickets in children, and it wasn't really very interesting or exciting. And then we began to realize that it took a long time for vitamin D by itself to have its biologic actions. And so I embarked on looking at human blood to see if there was a vitamin D metabolite present, and identified 25-hydroxyvitamin D as the major circulating form of vitamin D, which you now can ask your doctor to measure to determine your vitamin D status. And then I went on and got my PhD by identifying the active form of vitamin D, known as 125-dihydroxyvitamin D. I'm an organic chemist, and my roommate and I were the first to chemically make the active form of vitamin D, which was used to treat bone disease and kidney failure patients, because we realized that the kidneys activate vitamin D. And the reason for the bone disease was that they couldn't properly activate it.
And that's available as a prescription drug, right? Rocaltrol?
That's correct. And then I became interested in understanding how do you make vitamin D in your skin. And so worked out basically all of the methods to determine time of day, season of the year, latitude, degree of skin pigmentation, obesity on this vital cutaneous process. And then I also realized that the skin had a vitamin D receptor. And what that means is that the active form of vitamin D was working in the skin, and I wanted to know why. And it turns out that active vitamin D inhibits skin cell growth, modulates it in a very important way. And I then realized that maybe you could use it to treat a very common hyperproliferative skin disorder, psoriasis. So it basically introduced the concept in the mid-'80s of topically applying active vitamin D to treat psoriasis. And that's really one of the first-line treatments for psoriasis worldwide. And then I've done lots of other studies looking at how vitamin D is absorbed by the body and its impact on your health.
On that vitamin D for psoriasis, I'm wondering if prior to your deploying that advancement, if they were using sunlights for the treatment of psoriasis.
So they were using both UVB, which produces vitamin D in your skin, and it may be that that's one of the ways that UVB radiation that psoriasis patients are exposed to is the reason that it works. But they also use what's called PUVA, which is psoralen that you would take as a pill, followed by ultraviolet A radiation.
Okay, good. And maybe you can provide us with a list of your academic credentials and appointments. I believe you were you chairman or president of the American Endocrinological Society?
Sure. So I was chief of endocrine, diabetes, and nutrition at Boston University Medical Center from 1987 until 2000. I'm director of the Bone Healthcare Clinic, professor of medicine, physiology, and biophysics at Boston University Medical Center. And I'm also director of the Heliotherapy, Light and Skin Research Lab here at the university.
Okay, terrific. So you were, I guess earlier this year, you were asked to give a presentation overseas on the benefits of sunlight for health, and you shared that, and I was just incredibly impressed with the information that you compiled. So maybe you can sort of give us a primer before we go into the presentation you have for today.
Sure. So the primer is that when you're exposed to sunlight, all of the sun's energy is hitting your skin. And over the past 40 years, we've been taught that you should never be exposed to one direct ray of sunlight because it's going to cause skin cancer and damage your skin. But I think what they didn't appreciate is that when you're exposed to sunlight, there's a lot of important biologic processes and chemical syntheses that are going on in your skin. And the presentation that I gave an overview of not only how vitamin D is produced in your skin, but also the impact that sunlight has on helping to make you feel better, helping to regulate blood pressure, and a whole variety of other biologic processes, all because when you're exposed to sunlight, you do make very important biological chemicals in your skin that have important health benefits.
And this is distinct from actually swallowing vitamin D as a capsule, which is why I was so impressed with this presentation, because there are many people who believe that the sunlight is the best way to optimize your vitamin D levels, and then swallowing pills is just a poor second choice, but one that unfortunately the vast majority of the population has no alternative in the winter months.
Correct. And so, but in the spring, summer, and fall, it's very wise to take advantage of sensible sun exposure, and we'll talk about how you can do that in the presentation. Because you're right, that not only does it make vitamin D in your skin, but beta endorphin, which makes you feel better, nitric oxide, which can help lower your blood pressure, and a whole host of other chemicals that you would never obviously get just simply by taking a vitamin D supplement.
Okay, great. Well, thank you for that introduction, and maybe we can proceed into the presentation now.
Sure. So I think the presentation really is sunlight for your health. And I think that, like I said, the public's view of the sun over the past 40 years has been never to be exposed to one direct ray of sunlight, because if you are, you're at high risk for skin cancer as well as other skin damage, including wrinkling. So there's an evolution in thinking about sun exposure, which is in the 50s was the two-piece bathing suit, and the 70s was the one-piece bathing suit, and the new millennium now, everybody is wearing lots of sunscreen and a lot of clothing and preventing themselves from being exposed to any direct sunlight. And so bottom line is education. And it's important to realize that when you're exposed to sunlight, you're exposed to a huge amount of energy that's penetrating into your body. And it's also important to know that the atmosphere absorbs most of the damaging radiation that the sun is releasing, including X-rays, gamma radiation, UVC radiation. And so when you look at the solar spectrum for how much UV is actually coming in to planet Earth, it's a very tiny amount. And of all of the energy that's coming in from sunlight, very tiny amount of less than 1% is responsible for making vitamin D in your skin. And estimated that about 0.1% ultraviolet B radiation, which is responsible for making vitamin D, results during sun exposure on the surface of your skin. And so there's two forms of UV radiation that reach the Earth's surface, UVA and UVB. The UVB has higher energy than UVA. UVB has lower wavelength, but higher energy. And the reason that's important is that you would think that the UVB, which has the highest energy, would penetrate deeply into your skin. But it turns out that it doesn't. And the reason is that the protein and DNA and other chemicals in your epidermis absorb UVB radiation very efficiently. UVA radiation, on the other hand, is not as absorbed efficiently, so penetrates deep into your dermis and can cause skin damage, including cross-linking of your collagen matrix, increasing risk for wrinkling. And so bottom line is that increased wavelength, decreased energy, you have deeper penetration of this radiation into your body. In fact, when you're exposed to sunlight, the visible light like red light and green light, can actually penetrate into your body cavity. And we don't yet fully understand what the effect of that is on the human body and on human health. And so one of the responses, of course, to skin when exposed to sunlight is that your melanocytes begin to make melanin, that natural sunscreen. And what happens is that the UVB penetrates into the epidermis and that your melanocytes sit right between your epidermis and dermis. And that signal tells your melanocytes to make packets of sunscreen called melanin or melanosomes. And they rise up into the epidermis and they begin to coat all of the very important sensitive components of your cell, mainly the nuclei of your skin cells. And by doing so, acts as a very effective natural sunscreen. And UV exposure also, of course, will cause cross-linking of your DNA. And we think that maybe some of that cross-linking activity is actually the signal to the melanocyte to make more melanin. And you also have enzymes in your skin that help to break apart these DNA, what are called, that form together.
The cross-linking ones? So those enzymes repair the damage, the cross-linking?
Correct, exactly. And in fact, the Nobel Prize was given in chemistry for some of that research that was done to begin to understand when you're exposed to sunlight and you get these cross-linkings of your DNA, that these enzymes are there specifically to repair that DNA. So the story for lack of sunlight and its health consequences really began with the Industrial Revolution. And in the 16 and 1700s, children living in Glasgow, Scotland, throughout most of England, in the industrialized cities, developed severe bone disease, rickets. It was a Polish physician, Sniadecki, in 1822, that recognized something. And that is that he was seeing children that lived in Warsaw. And these children had a high incidence of rickets. But the children that lived in rural areas outside of Warsaw didn't. So he concluded in 1822 was strong and obvious of the influence of sun on the prevention and cure of rickets. And this association study basically went unrecognized for 100 years. And it would take more than 100 years to appreciate that insight, that sun exposure by itself can cure rickets. And so it turns out that also Dr. Finson began to realize that patients with TB of their skin, when exposed to sunlight and higher intensity light, could actually cause dramatic remission in their disease. TB was incredibly common over 200 years ago and even at the turn of the last century. So it was a major observation that actually resulted in him getting the Nobel Prize in 1903. And so lupus vulgaris, which is this known as TB infection of the skin, was effectively treated. As a result of Holczynski realizing that when you expose children to radiation from a mercury arc lamp could cure rickets, this led two physicians in New York City, Hess and Unger, to take some children, put them on the roof of their hospital, and demonstrated several months later that the rickets was healed. This was the first clear demonstration that exposure to direct sunlight had a health benefit for children, i.e., to help treat and prevent rickets. This led to a novel concept. In 1931, the US government actually set up an agency and sent out brochures to parents, encouraging them to expose their infants to sunlight. In fact, it's suggested in the advertisement that was sent out in the brochure that give the baby a coat of tan. Sunlight, health, and growth. It was heavily promoted. And indeed, mercury arc lamps were readily available in pharmacies, especially in northeastern United States and throughout most of Europe. And a parent would go to their local pharmacy, buy one of these lamps, and they would have their children wear eye protection, and they would expose their abdomen and arms to this radiation in order to prevent them from getting rickets. In the meantime, in the University of Wisconsin, Dr. Steenbach realized if you're going to radiate people and animals to prevent rickets, why not irradiate the food? So he introduced the concept of adding the precursor of vitamin D to milk and demonstrated that the milk had anti-rickettic activity. And as a result of that, with the fortification of milk with vitamin D, it basically eradicated rickets as a health problem throughout the United States and in countries that use that practice. So does sunlight have beneficial effects? So what about the good? Well, the production, of course, of vitamin D is good, but also people, when they're exposed to sunlight, feel better. And we also know, of course, that sunlight will regulate your circadian rhythm, and that seasonal affective disorder, which probably affects about 40% or so of children and adults, it can be a serious health issue. And so sunlight makes you feel good. When you're exposed to sunlight and you're directly exposed to sun in the summertime, all of those UVB photons are able to get through your atmosphere, and some of them reach the Earth's surface, and you make vitamin D in your skin. But we went on to show in the wintertime, the sun's rays are more oblique and has to go through more ozone. And the question was, does this have any effect on vitamin D synthesis in your skin? And we went on to show that basically, if you live above Atlanta, Georgia, that you cannot make any sufficient vitamin D in your skin from about November through February. And in Boston...
Now, is there an exception to that, which I learned when we were together, is that if you're at elevation, the altitude makes a difference because there's less ozone or less atmosphere for the D to penetrate.
Yes, and there's no question about that. We did a study at base camp of Mount Everest. Dr. Sauter worked with us, and he was on his way up to base camp, so we gave him some samples to expose in Agra, which is at sea level, and then all the way up to base camp. And we could show in Agra, India, where the Taj Mahal is located, in November, they could not make any vitamin D. But at about 15,000 feet, they were able to make robust amounts of vitamin D. So you're correct, is that the less atmosphere that you have to go through, more vitamin D you can produce. And it was also curious that in Switzerland, it was known back 100 years ago that if you lived above about 5,000 feet altitude in the Swiss Alps, that you would not get TB. Whereas if you lived below that, that you were at high risk for getting a TB infection. And so we went on to show that, in fact, in the wintertime, basically, if you live above Atlanta, Georgia, you make no vitamin D. And even in Florida, even in Miami, you only make about 10 to 20% of the vitamin D that you would make in the summertime. We've also been taught to go out in the early morning and late afternoon, go jogging, make your vitamin D less damaging to your skin. Turns out probably to be one of the worst times to be outside because you're getting blasted by UVA radiation, which can alter your immune system and maybe even increase risk for melanoma. But you make essentially no vitamin D. Vitamin D is basically made in your skin from about 10 a.m. until 3 p.m. for the same reason that you only make vitamin D in the spring, summer, and fall, because in the early morning and late afternoon, the sun's rays are more oblique and they're absorbed by the ozone layer, and as a result, you don't make vitamin D in your skin. So how much do you want to be exposed to sunlight? And of course, we did a study, and we took healthy adults and we put them in our tanning bed in a bathing suit. And if you get what's called a minimal erythemal dose, a light pinkness to your skin 24 hours later, and then gave them an oral dose of vitamin D to see what that was equivalent to. And we found it's equivalent to about taking 15 to 20,000 units of vitamin D. So the body has a huge capacity to make vitamin D in your skin. In fact, we went on to show that if you're exposed to a tanning bed for half the time that it would cause a mild sunburn, just a couple of times a week, it was more effective than taking 1,000 units of vitamin D a day. And this is for skin types 2, 3, and 4. So these are people that had a relatively dark skin tone. So does sunlight provide you with your vitamin D requirement? It turns out that even a very nice study in Denmark showed your peak blood levels are always at the end of the summer, and the lowest levels are always at the end of the winter. So what I typically recommend as kind of rule of thumb is if I know I'm going to get a mild sunburn after being exposed to sun, say in June at noontime for about 30 minutes, then I go out for about 10 to 15 minutes, arms, legs, abdomen, and back when appropriate, and always wear sun protection on face. After that exposure, now put sun protection on or wear more clothing to prevent the damaging effects from excessive exposure. We also asked the question, why do people feel well when they're exposed to sunlight? And so is it possible that when you're exposed to sunlight that you make a happy substance that makes you feel better? And of course, the happy substance that most runners know for the runner high is beta endorphin. And so several studies have been done, including studies by my own lab, looking at whether or not exposure of skin cells to ultraviolet light can actually enhance the production of beta endorphin. And so when we did a study and looked at both UVA and UVB, it was mainly UVA plus UVB that was able to stimulate your epidermal cells, known as keratinocytes, to make beta endorphin. So the obvious next question is, does it enter your bloodstream? And a very nice study that was done at Massachusetts General Hospital showed that when they took healthy adults and exposed them to UVA and UVB, that they could increase beta endorphin levels in the blood by about 44%. So we believe that when you're exposed to sunlight, especially ultraviolet B radiation, that you're producing beta endorphin in your skin, enters into your circulation, probably is going to your brain, and it's basically the endogenous opioid. It makes you feel better. And so studies have also been done by Dr. Slominski, again showing very nicely, taking people, exposing them to ultraviolet light, and demonstrating when they took a biopsy that beta endorphin was being produced. So we have a variety of different types of studies that provide very strong evidence that when you're exposed to sunlight, probably one of the reasons you feel better is because you're making beta endorphin in your skin. And it also, of course, gives you a feeling of relaxation and stress and helps in pain management. So there's a lot of different benefits from beta endorphin being produced in your skin that often is not completely appreciated. And even there's been studies to look at depression and whether when exposed to sunlight, does depression levels decrease? And is this possibly due to the production of beta endorphin in your skin? And at least one of the studies was very suggestive that that was in fact the case. We also know, of course, that when you're exposed to sunlight, it's the blue light coming through your eyes that regulates your circadian rhythm, and it goes through the pineal gland. And what it's doing is it's decreasing the production of melatonin, which, as you know, is a hormone that can help you sleep. And so people with seasonal affective disorder, one of the major causes is their inability to be able to appreciate the intensity of sunlight coming in the fall, winter months. And as a result, they're unable to suppress their melatonin levels. And because their melatonin levels are constant throughout the day, they want to sleep all the time and they get depressed. And so we're now recognizing that bright light therapy, about 10,000 lumens for about 30 minutes to an hour in the morning, is quite effective in helping to suppress melatonin levels and therefore makes people feel more awake and have less of the seasonal affective disorder symptoms that would otherwise occur. But one of the other questions that I was curious about was, if you're exposed to sunlight on your skin and not through your eyes, is it possible that your skin cells also have biologic clocks, that possibly your skin cells actually know when they're being exposed to sunlight and what the time of day is? How to look at that? Well, it turns out that there are studies that have been done, for example, even of fruit flies, and they have what are called transcription factors. These are factors that are made by the cell to help regulate nuclear activity, expression of genes, and these are called clock genes or period genes. And a study that was published many years ago in Science showed that even fruit flies have these clock genes spread throughout their entire body. And so with that information, I decided to do a study and to simply have expose human cultured skin cells to ultraviolet A and ultraviolet B radiation, and to look at whether or not we could see by what's called immunofluorescence the increase in the production of these so-called circadian rhythm genes, clock and period genes. And what we were able to show very nicely is that the period 1 gene was markedly increased in its production just by being exposed to ultraviolet B radiation. And similarly, the alpha clock gene was as well. What about hypertension? It turns out, curiously, that blood pressure is higher in the wintertime than it is in the summertime, and that there is this seasonal effect. And so when you feel better in the summertime, you're more relaxed, and that certainly could be one of the explanations for why your blood pressure is lower in the summertime. So we did a study, and what we did was to ask the question, since we knew that vitamin D seemed to have an effect on blood vessels, is it possible that when you're exposed to sunlight, that you're making vitamin D in your skin, and that that vitamin D eventually getting activated is helping to regulate your blood pressure? So we took healthy adults and put them in our tanning bed that we have in our clinical research center here at the university. And we exposed them to the tanning bed UVB radiation. And then what we did was we put a plastic filter over the lamps so it blocked out the UVB and exposed healthy adults to this radiation to act as control. And what we found was that those that were exposed to UVB radiation raised their blood levels of 25-hydroxy vitamin D, which is a measure of your vitamin D status, by about 100%. The UVA group, there was no change in their blood level. So we were confident that the study design was appropriate, that we were looking only at the effect of increasing the production of vitamin D as it related to blood pressure. And what we found was that the systolic and diastolic blood pressure decreased by as much as 6 millimeters of mercury. And those exposed to UVA radiation, there was no benefit at all. So from this study, we believe that yes, when you're exposed to sunlight and you're making vitamin D, that it does have effects on probably causing vascular relaxation and therefore helping to lower your blood pressure. And that's consistent with a lot of other data that's out there to show that peripheral vascular disease has been associated with vitamin D deficiency, about an 80% reduced risk of having peripheral vascular disease if you simply are vitamin D sufficient, a 25-hydroxy vitamin D level of greater than 30 nanograms per ml. So the obvious question is, can you get enough vitamin D from your diet? Are there other health benefits of being exposed to sunlight? I hopefully have convinced you that you basically cannot get enough vitamin D from your diet. So only oily fish, cod liver oil, and mushrooms exposed to sunlight are the only sources. You get a little bit from dairy and now from orange juice, about 100 units in a serving. But we estimate that children during their first year of life, the endocrine practice guideline recommends 400 to 1,000 units a day. Children 1 to 18 years of age, 600 to 1,000 units. My preference is personally for teenagers, they should be like adults, at least 1,500 to 2,000 units a day. You cannot get this from dietary sources. So what's the best source? Of course, it's sensible sun exposure. Well, how do you know that? Well, it turns out that time of day, season of the year, latitude, degree of skin pigmentation all influence this. So we developed an app, dminder.info. So dminder.info. It will tell you anywhere on the globe, any time of the year, for any skin type, whether you can make vitamin D, how much vitamin D you're making, and it will actually warn you to get out of the sun so that you don't get a sunburn and you don't significantly damage your skin. I'm always asked how much vitamin D do I take? So I take approximately 4,000 units a day from all of my sources, and my blood level on average is about 55 to 60 nanograms per ml. There's no question, I don't think, that lack of adequate sun exposure and vitamin D deficiency has a major health impact. In fact, many of these chronic illnesses that I've talked about, if any of them turn out to be associated with sunlight deficiency and vitamin D deficiency, there really is no downside to improving your vitamin D status, just as what was done over 100 years ago when ultraviolet lights were used in hospital settings to help fight infections and to prevent rickets in children. And we did a study in tanners in Boston and asked a simple question, right? Does it have any impact on their health? And one of the best ways, of course, is just to looking at bone mineral density. So we looked at tanners that were exposed to at least a tanning bed once a week versus non-tanners, and looked at their blood levels of 25-hydroxyvitamin D in the middle of the winter. Tanners had robust, healthy levels, on average of about 50 nanograms per ml. Non-tanners, those that never went to a tanning bed and basically were just having a couple of glasses of milk a day, their blood levels on average were about 18 nanograms per ml. When we looked at their bone mineral density, we showed that in fact tanners had higher bone density in both their hip as well as in their lumbar spine. So vitamin D does play a role in your bone health. Sun exposure helps to provide that, and we think that the tanning, using a tanning bed that has UVB, will improve your vitamin D status, improve your bone health. Also consistent with the National Health Survey data, they showed the higher your 25-hydroxyvitamin D, no matter whether you are Caucasian, African American, or Hispanic, higher is your bone density. So to summarize, if you look at the spectrum of sunlight that reaches the Earth's surface, UVB radiation is responsible for making vitamin D and certainly will cause sunburning if exposed to too much. It also improves beta endorphin production in your skin that makes you feel better. The UVA radiation is also produced beta endorphin, but also modulates your immune system. It also produces nitric oxide and carbon monoxide that cause vascular relaxation and may have improvement in wound healing, help fight infections, among other biologic processes. And blue light is certainly important for regulating circadian rhythm and suppressing melatonin levels and helping to improve your mood and have less symptoms of seasonal affective disorder in the wintertime. So bright light therapy works. And now more studies are being shown that red light, infrared light, and even blue light exposed to the skin can improve wound healing, can reduce wrinkling appearance, and has other biologic effects. So there is no downside, in my opinion, to improving your vitamin D status and getting some sensible sun exposure. And I don't think we need to be a genius to know this, that we need sensible sun and vitamin D supplement recommendations. It's not a hypothesis, right? Even the World Health Organization talks about sunshine and health and says the sun's rays provide warmth and light that enhance your general feeling of well-being, stimulate blood circulation. Some UV radiation is essential to the body as stimulates the production of vitamin D. There is no doubt that a little sunlight is good for you. I thank you very much for your kind attention.
Terrific. Well, we really appreciate all your knowledge and wisdom and years of effort in this field to help us understand the full value, or at least highlights of the values of being exposed to this sunlight on a regular basis in addition to the vitamin D benefits. So thank you.
It's my pleasure. Thanks for the opportunity, and have a delightful day.